Sean, for the whole country, Nevada included, the impact of COVID-19 has been felt in so many ways.
Mhm.
One way is changing the way that we approach our healthcare. And it's interesting because sometimes in times of crisis, it actually encourages innovation. And we are joined by our next guest who's going to talk to us all about it.
Absolutely. And she is Dr. Lorene Tibaldi. She's joining us now, the CMO, the Chief Medical Officer with United Healthcare Nevada. It's great to have you. How are you?
Hi, thanks. Thanks for having me. I'm doing well.
Excellent. Well, it's great to have you, and we thank you so much for joining us today. Obviously, COVID has been a real buzzsaw for pretty much everything in our lives, but the healthcare industry in particular, telehealth was a thing before COVID, but man,
Mm.
is it the new hotness now, isn't it?
Yes, it certainly is. And it's only going to grow. So, just to kind of level set for everyone, telehealth is really the convenience of having a doctor's visit in the comfort of your own home. So, folks can access their doctor through their phone, through their iPad, through their laptop.
Mhm.
It's really quite convenient. And the provider can actually diagnose your condition, give you advice, prescribe medication. So there's a whole host of things that can happen with telehealth.
Yeah.
It's interesting because it was around before the pandemic, but really didn't take off as much until the
Yeah.
pandemic.
Yeah.
So it's really been quite convenient. And a lot of insurance plans like ours have really encouraged the use of virtual visits for our patients. A lot of Americans just weren't able to or just weren't comfortable going to a healthcare facility in person.
Yeah.
So this
Yeah,
has really
certainly.
bridged that gap.
Mhm.
Yeah.
Isn't that
In
true?
fact,
I mean, there is sorry, doctor. I was just going to say there is like a certain risk right now with many people when they think of going into an office. So that has obviously increased the popularity of telehealth.
oh, definitely. I mean, through June of this year, we've seen 10 times as many telehealth visits as we
Wow.
Wow.
did last year. So that is huge.
Yeah.
Yeah. And it's not just primary care, there are actually a lot of specialists using it and specialty services. United Healthcare has actually seen some physical therapy, occupational therapy, and speech therapy being done through telehealth. So it's quite diverse. It's just really accelerated in a good way. And people's homes can really be an extension of the doctor's office. And I think the public is learning that even more with their use of telehealth. And this is really important for us this year because we've seen steep declines in our wellness visits, in our preventative visits. So I really encourage everyone to check with your doctor or your health insurance plan to see how you can use telehealth. In fact, recently, the data is showing that a lot of Americans even still don't feel comfortable going to their doctor's office.
Yeah, it's certainly it's a tough thing because ultimately people don't want to get COVID because they want to stay safe, but by not getting the those little maintenance checkups, they might be putting themselves in more risk for other things. So if the COVID doesn't get you, it might be something else. So you got to get checked out one way or another. We're running out of time. I want to point out the other things that have really changed. The role of a pharmacist seems to be changing right now, doesn't it?
Yes, pharmacists have always been trusted advisors for a lot of people. I mean, if you think about it, people may only see their doctor, what, 2 or 3 times a year, but you might be seeing your pharmacist each month, so
Yeah.
12 times a year.
Mhm.
So pharmacists have really gotten involved with our patients, and the pharmacist's role is really expanding. We're seeing immunizations being given by pharmacists, and in fact, there are some states that have expanded prescribing rights to pharmacists.
Wow.
So that's been really exciting. Pharmacists can really get involved with your medications. Even in the behavioral health world, they've gotten involved. They've been doing screenings for depression, helping out with medication adherence, and really helping patients manage their meds.
Nice.
Well, thank you so much, Dr. Tabaldi, for joining us today. And we're going to, refer people to your website, healthplanofnevada.com. And we have a phone number that Sean's going to pull up on the screen too, because he's magical, because he runs this all from his house.
I
So
really
it
do.
was a pleasure talking to you today.
Very talented.
Thank you so much.
It was
Voila.
great talking with you. Thanks so much.
Have a great day. Hey, listen, healthplanofnevada.com is a place you want to go. You could also call 1-800-720-7253. Health Plan of Nevada doing amazing stuff to help keep you healthy. And they're a proud sponsor of The Morning Blend.